Okay, what age group do you guys think has the most anxiety? Anybody?
High school.
Yes. Well, yes and no. While many people would think that those in their middle ages have the most anxiety, it is actually those aged 18 to 24, the age group called the young adulthood. These age groups are more prone to stress, anxiety, and they're among the most anxious, most stressed, and most depressed age group in the country. So, do you all know what anxiety is? Can somebody tell me what anxiety is? Anybody?
Stress.
Okay.
I don't know.
Yes, stress. Anxiety is intense feelings of dread and worry that make you want to avoid stuff or make doing things really hard. And that is what all anxiety disorders share. They share that feeling of dread and also avoidance. So I want to cover 3 of the most common anxiety disorders in college students: panic disorder, social phobia, and generalized anxiety disorder. Panic disorder is perhaps the most cruel anxiety disorder in existence. You live in constant fear of these random, extreme attacks of panic, which is what they're called panic attacks. Social phobia is exactly how it sounds. You live in fear of social situations where you might be judged. And then generalized anxiety disorder, you feel anxiety about anything and everything in existence, and it lasts for at least 6 months, which I don't know about you guys, but that's a long time to live in fear. So, according to College Students, Mental Health Problems and Treatment Concerns, a book that I used to research this, 12% of college students have some form of diagnosable anxiety disorder. Whether this was something that started when they were younger, such as social phobia that has an early onset of around 7 years old, to generalized anxiety disorder that is usually just starting when someone enters college, onsetting about when they're about 20 years old. There are many factors that make college students the most likely to get anxiety. These factors include a new environment, academic pressure, independence from family and support systems, and other changes in their lives. 88% of counseling directors report an increase in severe diagnosable psychological issues that require treatment. They also report an increased need for counseling and specialized services for these disorders, all according to college students' mental health problems and treatment concerns. But there is still hope. According to Everyday Health, there are many different treatments for anxiety disorders, such as talk therapy, most commonly in the form of cognitive behavioral therapy, which is where someone works to change the thoughts that they're having and act in ways that are more conducive to being happier and being less anxious. There's also medications such as antidepressants and anxiolytics that can help to ease the anxiety and make life and managing these disorders just a little bit easier. There are also many natural remedies such as yoga, meditation, and then changing diet and exercise that while many people dismiss these are actually among the most helpful. So in conclusion, despite there being a wide range of anxiety disorders, there's an even wider range of treatments available for them. Thank you.